every single time you go to implement anything. There will be naysayers, there will be people pushing back. And frankly, you want that. It makes you double check and triple check things. That's supposed to be part of the design process.
This is Inspiring Women. I'm Lori McGraw, and today I am speaking with Kristi Henderson. Kristi and I have been trying to have this Inspiring Women conversation for some time now. Kristi is a longtime executive at many unbelievably impactful organizations. She has scaled innovation from the beginning, starting in the way back at the University of Mississippi Medical Center. She began her career as a registered nurse practitioner. She led care, she led innovation. Some people might not know that the University of Mississippi Medical Center was actually at the forefront of telehealth and telemedicine. Kristi's no stranger to that. Today, she's the CEO of Confluent Health, which is an organization, a family of physical therapy and occupational therapy companies. Kristi, thank you for being on Inspiring Women.
Laurie, thank you so much for having me. We have been trying to get this scheduled, and so I'm just thrilled to be here to be able to join you. It's so important to have these conversations. So thank you for having this podcast and inviting me on as well.
Let's start at the top. So, Kristi, you have led transformation at Amazon Care,
Yes.
Optum as a CEO, Ascension, now Confluent Health. You invented telemedicine at the University of Mississippi Medical Center. Truly, I mean, that was absolutely at the forefront. Today, as CEO of Confluent Health, what are you doing differently as a CEO today than at all those other executive level positions that you've held?
Well, great question. First of all, they all layer on top of each other. I've learned so much at each one of those, and every one of them was so different, whether it was an academic medical center, a national nonprofit health system, big tech, a Fortune 5, pay provider organization. Every one of them were had a different lens on healthcare. And you got to remember the first, 24 years of my life at the academic medical center was practicing clinician. And so I try to take a system level view with the frontline mindset and keeping grounded on what's most important, which is our patients and transforming the healthcare system and experience so we get better outcomes. But you cannot do that without transforming the workplace for our clinicians as we're all struggling with a workforce shortage and just, more and more demands on our clinicians. So, I think they all layer on top of each other. And what I do today is different than what I did yesterday because I'm growing every single day.
Yep. But come on, Kristi, like CEO, registered nurse, nurse practitioner,
Oh,
wildly different jobs. So
yeah.
at what point in the care delivery over those 24 years did you say, hey, you know what? I can do better leading, working at the top versus working at the bedside?
Yeah, it was not a grand plan from the beginning at all. It was one of really out of opportunities knocked on the door. But every time I would bump up against a challenge, I would raise my hand to say, hey, let me fix this. And so, other than my first job and my current job, every job in between has been a new role. It was not a posted position where somebody said, I'm looking for an XYZ. I created those and raised my hand and said, I want to take on that challenge. This is a problem in the healthcare system. And so they were wildly different, but the road and path that I got there was very logical when I look at it. I mean, but it was one step at a time. And, it was really hard moving away from being an individual contributor as a clinician where you have deep relationships with patients. You can see immediate rewards from someone getting healthier to one of more of a position of influence where you're trying to create a system change so that there's a ripple effect of a much bigger impact versus a one-to-one. So look, everyone takes their own path. Mine was just one of many open doors, people that believed in me, and I raised my hand and jumped in to take on the challenge.
Okay, well, jumping in is like it is actually the most important step. Were you always somebody who raised your hand for the complex challenge?
Yes, I think so. It's interesting. I was really shy as for a long time, but it's almost like I didn't want to be a victim or have to deal and live in a system that didn't work. And I didn't want to be a complainer. I wanted to be able to lean in and say, I'll do this. And so I did often take things no one else wanted, and whether it was turnarounds or some kind of transformation, change management, the one unit in the hospital that no one could staff, whatever it may be. I just was determined to. I love to challenge, and so I think there is some innate characteristics that I have that make that my natural instinct.
Well, it's actually interesting that you talk about sort of, the unit in the hospital that nobody
Hmm.
could staff as a, because like that is a challenge that we can all appreciate what that might look like, even if we haven't experienced it ourselves. But let's talk about transformation.
Hmm.
And I'll pick one of the amazing organizations that you've led. So, Amazon Care.
Hmm.
20 years ago, Amazon Care, 15 years ago, Amazon Care didn't exist. You developed it. That is a enormous amount of innovation and change that you spearheaded there. What lessons did you learn from doing it there that you're now bringing to Confluent Health?
Oh, I learned so much at Amazon. I vividly remember the first day sitting in a meeting with this just wickedly smart, analyst and engineers and others. And so Kristen Helton had this vision at Amazon to uh, build a model of healthcare first for our own employees that included virtual care and home-based care. And so I had come out of a traditional healthcare system. Had academic medical center and then Ascension Health. But when they asked me to come and join them to build out this, medical group and home-based care and really redesign, I couldn't resist. It was like I have to be there. Look, they do such a great job with everything else that they do. Surely I can learn something from them. And so what I loved about it is they challenged every assumption that we had. So many times we just assumed you couldn't do something or couldn't change something in healthcare, and they questioned everything. And so I'd first say the mindset of this just relentless focus on the customer. That we all know, we all are very happy when we get our packages every day from Amazon. They do it well, but it's because of an obsession around measuring and analyzing your customer. And so knowing your customer is one. The second would just be around the methodical execution and focus on small projects, and you staying focused, and they would just go, and they would go fast. But the teams worked really well together. Engineers, clinicians, business, all of those came together. So we there was a philosophy they have, which is either a one-way door or a two-way door. And if a project has a two-way door, meaning that if it doesn't work, fine, you'll just pivot and try something
Yeah.
else, go fast. But if it's a one-way door, meaning it can hurt your brand, there's a safety risk to a patient, whatever it is, that's where you're going to take longer, be more methodical. And so I just love that mindset. There are a lot of other things that I took from that experience and took to me to Optum and currently today and how I run change management and even run teams.
So, Christy, those things, though, so one way doors, two-way doors, and other things that you've done scaling organization. I mean, look, you've been at academic organizations as an executive leader, nonprofit organizations as a board member, chair of the board, executive leader, big tech companies, fast tech brand name companies, payer provider organizations. Those are wildly different
Mm.
organizations. Has your leadership style changed based on the organization, or how do you adapt to the circumstances in terms of wherever you are leading?
So I think it has to. I mean, I think you have to know your audience. And I think that there are skills that are transferable. And then those are experiences that where I can, you know, share knowledge from implementing or doing change management in one of these other organizations that is transferable and applicable. It's a lived experience of what worked and what didn't work. But clearly there are different dynamics and the organizational structure and the way that the power dynamics of the organization, they're different in every one of them. And you do have to learn that. And inherent to all of these is if you don't build trust, you don't have credible data, and you don't execute and aren't reliable, you're just not going to get anything done. And so everything I've done has been focused on the data, making sure the why. Why are we doing this? What happens if we don't do this? It is just really important. So I try to tell a story and make a very tangible outcome real. So if I'm implementing something, we set a goal. It's we're going to be the company that leads in this. This is what the experience is going to feel like, and so you can then rally people behind that. People believe in what we're trying to do, and it makes it personal, and then they want to be a part of it. So, yes, it's different in every organization, but there's definitely transferable skills.
And then, Christy, you have been very clear and spoken often about change happens at the speed of trust. Even though you've led vastly different types of organizations, the through line has always been in care delivery for the patient. So, with trust as maybe a North Star or one of your North Stars, how do you go about making that change happen? Because we do know that in healthcare organizations, big tech, academic, change is hard.
Mm.
It's just very hard. So not just the what, but how are you in particular successful at making that happen?
I think one of the strengths that I bring to the table with that is that front line. I've worked at every level. I didn't just start at the top. I've worked every single level in the health system. And so there's an empathy, a relatability, but I genuinely want to make sure that what we're doing is something that we can execute. And so that takes a few extra steps. But, whether it's in my current organization and going around and visiting clinics, talking to patients, talking to the clinicians, building work groups that have voices from all the different stakeholders with a responsibility to speak up and be the voice of that individual so that we build and design something that will be adopted, is one piece that I just don't. It's a non-negotiable for me, and I like the word reverse innovation. There's been articles written about that tactic that I use, but I believe a bottoms up tactic is always better. And so I think it's just partnering with people on the front line and not losing that focus around it's got to be good for the clinician, it's got to be good for the consumer, and then it has to be a sustainable, durable, business model that works for the company. And when you get all of those right, you move fast. But the way I build the trust is by building relationships, and then I'm not scared to talk about what the elephant in the room is. If there's a naysayer, I bring them to the table. I ask what you're, worried about or concerned about, and then we either change what we're doing to address that, or we have a good, healthy discussion around why that's not fact. And look, I'm making it sound like it's easy, but it is very hard. But what has worked consistently every single time is rallying a bunch of people that are excited about the purpose and mission of where we're going, and they're just bullheaded and relentless about getting it done. And it creates an energy. And when I'm with these teams, there's just a determination to make it happen. And it's a lot of fun. There's nothing better than launching a new product or seeing a change through. Even if you have bumps along the road, it's a lot of fun. So that's how I do it.
There's nothing like it. I mean, like, just moving into that state of just like, we've got this, and it is really awesome. But you're absolutely right. It is hard along the way. So maybe Chrissy, like, give us an example of like, because making those things happen, bringing people together to rally to a big milestone, a cause, a change you're trying to make happen for the people that you are delivering care for. Can you maybe describe a time of where it was hard to get somebody on board with what you wanted? And how did you overcome that? And in particular, usually like an obstacle is somebody with a powerful way to say no, slow you down, not say yes when you need them to. Can you give us an example or two of where you actually were able to turn that around?
Well, first, I'm sure your audience knows this, but that happens every single time you go to implement anything. There will be naysayers, there will be people pushing back. And frankly, you want that. It makes you double check and triple check things. Now, it can get annoying
Do
and you
you
have to
want that? It
figure.
feels terrible. It
No,
feels
it's terrible.
terrible.
It's terrible. It's terrible. It's terrible. It is. But it's just life. And there are people that their intentional role, whether it's your CFO that's challenged you and around the business case to it, whether it's the operations team saying there's no way to put this into the workflow, your clinical team saying it may put risk to your experience you have with your patients. that's supposed to be part of the design process. So I would say that there is not one that has come with friction and naysayers, but that's part of the journey, and you have to get comfortable with that and be willing to lean into it and answer the questions, or you will not get the momentum that you need. There's an example in every organization. Clearly, the one that was probably the most challenging was because it was ahead of the time was when we started launching telehealth early, well before anybody thought it was, before the pandemic. But early in, it was actually
Remember
2003.
those days? Do we remember
Yes,
those
yes.
days?
And honestly, there's still challenges with any use of technology in healthcare to this day. You still don't have a clear process for getting paid like you should, all the, scope of practice and, all the things that are necessary. So you got to remember, though, that you're changing an entire system that has been built on doing healthcare one way. You go to a clinic, you document this way, you build these codes. And now it got flipped on its head. And so when I started doing that, not only did I do that, but I used, nurse practitioners in the model, which was also at the peak time of tension, and nurse practitioners were still new into the care team. And so there was a lot of pushback from medical boards, nursing board, pharmacy board, legislators, uh, even the health system that I worked with. And so I went and got funding elsewhere, and we just took it slow. And it took a lot longer than I would have wanted it to. And I can look back now, it's still running today at the University of Mississippi. It's still just a cornerstone of how healthcare is delivered. It is critically important. And it's proven that out. But sometimes you're just going to get that resistance and be willing to do a smaller project that says, look, I'm going to prove it to you. I'm so determined to make this happen. And you just have to push through it. And, I don't know that I gave any magic wand answer that anybody in the audience doesn't already know, but don't give up. And when you get that resistance, find a way to push through it, and you know, you'll be able to scale it.
There's a lot of determination in there. Christy, again, so many, if we look at across your career, it looks like a storybook. Like it was easy, and I'm confident it wasn't. At this point, what mistake will you never make again that you made in the past?
Well, the piece that is the most important, and it will speak to, I'll connect it to something in my current role, is the communication with just communication in general. I'll be very specific though. The first person I hired when I took this new role as the CEO of Confluent Health was the leader for our internal communications. Because if you're going to do change, if you're going to get people excited about what you're doing, especially when you have a dispersed workforce across the country, you got to figure out how to keep people aligned, updated, excited, involved, engaged, all of that. And so often you'll start running with a project, and I've done it before, where you get ahead and you haven't managed stakeholders. And that may be investors, that may be your boss, that may be your team, that may be your patients, all of that. So if you skip the important step of bringing people along, you, I won't say you'll fail, but it will definitely be more painful than it has to be.
Yeah, that is for sure. And learning that the hard way, sometimes I just so many leaders that I talk to, I've experienced, learning things the hard way is sometimes the best way
Mm,
because you will make so many mistakes, in across a career that you have, and the ones that are the worst ones that are just like, okay, there's just like that is not happening again. So to get those things in place, it allows you to speed up. It allows you to have bigger impact, oftentimes. So that's just fantastic. Chrissy, I also wanted to ask you about something that is important from my perspective as well. You talk about bringing joy back to medicine. We
mm,
all know. Through the time of the pandemic, I know from my time at the American Medical Association that we have seen a tremendous amount of burnout in the area of physicians, nurses, caregivers, clinicians. Is it getting better? Is it getting
mm.
worse? Where are we today? And why are you so focused on that at Confluent Health and more broadly?
So I'm definitely still focused on this because I think we have a national crisis of a workforce shortage. I think that it has settled down some from where you saw a mass kind of turnover and exodus from different people in the clinical realm during the pandemic, where people were really reflecting a lot around what they were doing, how they were going to spend their time. Look, it was a scary time for so many, and healthcare took the brunt of it as they were worried and scared for themselves and their own families, but they're having to show up at the front lines and take care of individuals with COVID and all the challenges that came with running a health system in that type of environment. So I could look before that, and we were working on joy, and at that time joy in nursing, joy for physicians, addressing, we got that real name of burnout that became more of a craze during the pandemic, but it's still a problem. I think that turnover and people leaving the profession sooner has changed, but I think it's because people are truly approaching their positions a little different. I think there's more people doing part-time positions, or people splitting between maybe teaching and clinical care. So I'd say it's still an issue. We still have a workforce shortage, and the administrative burdens of healthcare aren't going away. What I'm really, really optimistic about is the continued improvements from technology, specifically from AI and automation. And so before, where I was trying to innovate, how can we distribute healthcare using technology? Now I'm thinking about it more in the sense of how do I use that technology to allow the environment, the clinic to operate better for clinicians, whether that's a physical therapist, a physician, or a nurse. How can they do their job without all the friction of paperwork and computers? And so there's so many things, whether that's the clinical documentation AI tools that are capturing conversations, creating notes, and helping, take out hours and hours of documentation, or it is the time that's removed from having to manage denials with billing or whatever it may be. There's not a single aspect of the healthcare system that's not going to be transformed by AI and automation, and we're doubled down on that. Anything that I can do to allow superpower all of our employees, and let them focus on what they're great at and what's unique that only a human can do. So it is a balance of bringing humanity and technology together to make this super powered healthcare system.
And I love that optimism because, my goodness, we certainly need it. I mean, the amount of administrative burden that has been brought onto the system. I grew up with electronic health records, implementing them, leading them, and for all the optimism I had there, the impacts were not everything that I wanted. And so I think that
Mm.
that time is absolutely here. So I want to close out with, Kristi, as somebody who's always been at the forefront of innovation, what are you using? What are your AI hacks that you're using personally,
Mm.
that will, I can learn from?
Well, look, I'm still learning every single day. I take courses on it, all kinds of things. So I've got a lot to learn, and it's moving so fast. Just as soon as I think I've mastered something, there's something even better, which makes it even more exciting. I love that type of speed, but I use it every day. I mean, I really do, whether it's as simple as managing tasks and figuring out and prioritizing, emails, or booking travel, or planning for events, or whatever, prepping for this meeting, right? This podcast, whatever it may be. I use it as a companion, and it's my sidekick to be able to help me think and work smarter. And so layering that into your systems so that you can move faster and spend your time where you need to, I just think it's a game changer. And I challenge everybody to every day find something where they can use it, because it will surprise you how easy it is and how much it changes your life. So
Yeah, effective and giving you the gift of time back, time
yes.
back. That's what we're all compressed for time. Well, Kristi, this was worth the wait. I have to say, I am so thankful for your participation on Inspiring Women. I've been speaking with Kristi Henderson, and Kristi, thank you so much.
Thank you, Laurie. I enjoyed the conversation.